Hi guys, Dr. Brian Opp here from Opp Family Chiropractic right here in St. Francis. And today I want to talk to you about ADD and ADHD. So what are the causes and what can we do about it, right? So we're going to do a little webinar on it. So the topic, we have this handy dandy guide that you guys can download too. After there'll be a link to it during this webinar so you can follow along, read more about it. I'm also going to be talking a little bit. A lot of the information is from the Nutrient Power book by Dr. Walsh here. Very informative book. There's a little technical parts to it, but overall not too bad to be able to read for the average person. So he gives some really good tips that we'll talk about here on some things that you might want to get tested, some other nutrients that we might want to use, and the fact that using medication actually isn't a good option for a lot of these people that have this. So let's jump right in. So what is ADHD? So it stands for Attention Deficit Hyperactivity Disorder, condition diagnosed from symptoms such as inattentiveness, impulsivity, and hyperactivity. Anyone can have ADHD. I myself would have been diagnosed with that, long ago. People of all ages are known to struggle with this. I've actually had adults come in and ask me about, hey, I have ADD, or it seems like I have ADD, ADHD. What are some things that I can do about it, okay? So some facts about ADHD and ADD have been on the rise for the past 20 years. You speak to any teacher that's in a class, that's teaching in a classroom, especially elementary student and preschool kids, teachers, they're going to say, yes, kids have changed over the last 20 years and 30 years. So the teachers that are retiring, it was much easier to teach a lot of the kids than it is now. Also, classroom sizes are getting bigger, so there's a lot more going on at that time. So approximately 3 million children. There's probably more if they would just, if everybody would just accept the diagnosis, it'd probably be about 6 million people. More common in males, very, very so. I talked to a lot of my patients about this, why the fact that is, and we're going to dig into that a little bit more. Costs $42.5 billion each year to Americans, right? So all the stuff that people try, to doctor's visits, to medication. And treatment is usually that stimulating drug, right? Adderall or Ritalin being the two most common ones, okay? Basically, it's meth, just a little derivative from it. So we're actually giving people drugs. Great. Okay, what are some causes? So your gut, right? So your gut talks to your brain. So when things are going on in your gut, you're going to have some stuff that's not going to be produced, or being able to produce, so that it can help your brain to be calm, right? So SIBO, which is just a shortening acronym for small intestinal bacterial overgrowth, which creates the gut dysbiosis, so the gut issues that we have. So you can have bacterial overgrowth, you can have a fungal overgrowth, you can have a yeast overgrowth. So a lot of times we're dealing with infections in a lot of these kids. Low hydrochloric acid, so we're just not digesting our food very well. What happens when you don't digest food at the north? A lot of stuff gets down too far where it should be already absorbed, and that those bugs start to eat that, and they grow and they grow and they grow, and we get infections. Digestive enzymes are actually what we call pancreatic insufficiency, so you're not doing enough. The pancreas isn't producing enough of those enzymes to be able to break down your fats, carbohydrates, and your proteins, right? So a lot of digestive issues. Low dopamine. So dopamine is a neurotransmitter. Some people call it the reward neurotransmitter. It keeps your attention. When you find something very interesting, your dopamine level goes up. When you eat sugar, it's a great dopamine lifter. That's why it's so hard to get away from. Movement. That's why a lot of these kids can't sit still. Why I use my hands a lot, because that helps to stimulate dopamine and keeps us focused. So low methionine. So this is something in your body that helps you break down heavy metals, helps something with called methylation. So when you have that low issue, it definitely creates a lot of this inability to make like dopamine in the body. Low zinc and high copper. So these last two things are from this Nutrient Power book. It's a very interesting thing to look at. So a lot of people are zinc deficient. It's been talked about over the last couple of years about how deficient people are in zinc. Copper is one of those things that it's really not talked about. But when you start thinking about where people get a lot of their copper from, what did we switch a lot of our pipes to? A lot of them were copper fitted pipes. So you're drinking a lot of stuff from copper. So we get a copper overload, okay? So let's talk about what raises low dopamine levels. Stimulants, well, that's why the Ritalin and the Adderall work so well. Sugar, you could consider sugar a stimulant, right? Candy, any of those stuff. Moving around, exercise. I put in here infinity walks. So these have been tested in classrooms where they have kids basically go in the back of the classroom when they're feeling like they need to get up and move. So they start tapping around, and what they do is they go in the back and they walk around a cone while they continue to watch the teacher. So it actually starts to train the brain to be able to focus while they're moving. Food and nutrients, right? So we talked about sugar, but how about some other things? So anything that actually produces proteins from you. So when you eat protein, there's something called tyrosine in there, and that tyrosine is able to make dopamine. Okay. Fix the gut and digestion. So we need to, like we talked about, address those infections. So whether it's a yeast infection, a bacterial infection, or a fungal infection, right? We could actually have we could put viruses and parasites in there. So whatever issue is overgrowing inside the gut, we want to deal with it. Address that low hydrochloric acid, get those digestive enzymes. With kids, a lot of times, if they can't swallow, we use something called bitters. So bitters are really good, and were used way before everything else. So bitters will help raise that hydrochloric acid so you can start to digest that food. Glutamine. What is glutamine so good for? It's good for the gut lining. So we like to use glutamine with these kids. It also can help produce GABA, which is very calming. Prebiotics, so some people are starting to say that prebiotics are actually better than probiotics, right? So prebiotics are actually what feed the nutrients that feed those bugs that are in your gut, the good bugs. And then, yes, we still use probiotics because our diets really aren't a lot of times hunkering down on a whole bunch of fermented foods. A lot people are starting to do a little more now, but once again, we don't eat a lot of those fermented foods in our diet. All right. 3 types of ADHD. So this was in the book as well. So inattentive. So some of the telltale signs that you can get tested, low folic acid or folate, B12, low zinc, and low choline. So choline, interesting, used to be thought of as you didn't need it. And then when they took it out of the diets of a lot of people, they started noticing issues with birth defects and low birth weights. So they added it back in, and hey, lo and behold, choline's a needed nutrient. Impulsive and hyperactivity, so constant motion. So these are kind of the most common ones there. Highly distractible, short attention span. So ladies, if you looking at your husbands and thinking, yeah, he definitely has that issue, sure. And your kids, you can start to look at those things. So some of the telltale signs, especially for this one, copper overload and zinc deficiency. So once again, getting on zinc, right? Raising those zinc levels up. Combination, so you can have both, right? Always fun. So the largest subset of ADHD, so you need the copper zinc ratio. These are the tests that I would have you go get, or we can have you run through our clinic. So a zinc copper ratio, pyrrole urine test. So these are something that's produced in your body that you can test that messes up a lot of the body's ability to make dopamine and have issues with, like we talk about this next thing, this methylation issue, and heavy metal tests. So heavy metals like with the copper, cadmium, mercury, aluminum. So there's a whole bunch of different things that are impacting our environment with these heavy metals, and they are hard to get rid of in a lot of kids. Methylation disorder. So this has been talked about for the last few years. It's kind of the big buzzword for gene issues. So MTHFR. What basically this is when you can't convert your folic acid into the methylfolate, so the active form, so that you can then donate a methyl group. Okay, so that just slows down the whole process of other genes, especially things having to do with dopamine and serotonin, right? Okay, toxins. So you can consider these heavy metal toxins. What you put on your hair, skin, and nails. We talk about this as well. We can put a link to our toxin webinar as well through this. And then pyrrole disorder. This is a very small subset, but a very real thing that can happen with a lot of kids. So getting it tested is a very good thing to do, just to rule it out. Okay. So poor gut health link, we want to just highlight that. So glucose dysregulation, malabsorption, that's that SIBO issue that we talked about earlier. And then we can put a link to that toxin as well. All right, recommendations that we would have when somebody comes in. So supplementing, we've talked to this over and over again, haven't we? Zinc, right? Most people are really, really in tune now with zinc because of immune health, but not really thinking of it as brain health, right? As being this ADD, ADHD helper. Glutathione. So what is glutathione? Glutathione is our master antioxidant. So when you think about antioxidants, people will think about vitamin C, vitamin E. Well, think about vitamin C getting rid of about 4 oxidants or reactive oxidative species. So the antioxidant portion of vitamin C get rid of 4 of those molecules, where glutathione gets rid of about 1 million. Okay, that's why it's called the master antioxidant, why it's super important. It can run low on a lot of people, especially if you're trying to clean up the environment inside so much. Selenium, a great little nutrient here, helps with viruses, helps with thyroid function, helps with methylation issues, and then with ADD and ADHD, okay? N-acetylcysteine or cysteine, so this is what helps with driving a lot of the glutathione process there. So you can take NAC to help make more glutathione, and you can take just straight glutathione as well too. A lot of times I like to just use NAC because it does so many other things than just building glutathione. Okay, tyrosine makes dopamine. When we think about the dopamine issues, when we're dealing with ADD, ADHD, think about it being low in tyrosine, because you can't make something out of nothing, right? So when we don't have enough tyrosine to make dopamine, how the heck are you going to increase dopamine without tyrosine, right? So, and if you can't digest your food, especially your proteins, you can't pull tyrosine out as an amino acid out of your protein. So there's where you see a lot of the stuff isn't just like take this. We got to look at all the whole body as a whole. B6 and B1, super important because that helps with building serotonin and dopamine, and lysine, because whenever there's B6, there's always lysine. So they're like married together. So I always like to use the two in combination. All right, other things you can do. Have a snack every 2 hours, right? Because we talked about food and nutrients, but not just any old snack, right? We want to look at things that are going to improve the tyrosine levels, right? And some of these, if there's zinc-rich foods, we can do B vitamin-rich foods. So those things that are real, right? So fruits, vegetables, protein snacks, as much as we possibly can. Those are always going to be super important. And then allow kids to move around, right? That's always the hardest part. We weren't meant to sit for very long, and we've seen the impact of sedentary lifestyles now. Obesity rates are increased, ADD, ADHD are being diagnosed, just immensely now because kids aren't allowed to move around. And we saw, you can look back at that Infinity Walk. You can see where they did it in Indiana. It just improved test scores, reading scores, and math scores immensely just by allowing kids to be able to move so that they can then come back and concentrate. All right, other things that we like to do, right? Chiropractic care is super important in our office. So usually we're going to be looking at the top. So a lot of issues that occur. So they could have a cranial issue. So we do some cranial adjusting. Looking at the occiput at the top, the very top bone in your body is C1. Think of that area as like the light switch to the brain. Looking down farther, so how are they breathing? Looking at the middle of the back. Are they having issues with, their low back as well too? So all those things to help with those nerves that go to those organs to be able to function better. Craniosacral therapy. If kids come in with ADD, ADHD, I automatically want them to get some craniosacral work. Why? Because it's very calming to the nervous system. So it gets them out of that hyperactivity state. It allows them to think better and then just have a happier, healthier life with that. Facts about craniosacral therapy. It's been used successful since the 1980s. We like to use the Upledger Institute training, so that's very good. So you can go to their website, upledger.com. Awesome there to get a lot of information. You see, it's very light touch, so the kids really enjoy it. They can calm down. It's in a very calming environment there. It looks for subtle changes. Basically, how I explain it is, so you have your skull and your tailbone, the sacrum. So that acts as pumps, right? So when you breathe, your skull actually still moves in and out. So it's still pumping fluid, the cerebral spinal fluid that bathes your brain and spinal cord to feed it, because there is no direct nutrients to be able to get to there other than that bathing system of the cerebral spinal fluid. So if the craniosacral therapist finds some blockages along any of that path there, from the cranium to the sacrum, they're going to work on that with some very light touch to open that channel back up to allow for that flow and that sensitivity to be much less. And you can handle your environment so much easier at that point in time. So those are 2 adjunct therapies that we like to do. So additional resources. So once again, make sure you download this, look at it. You can read this book, Nutrient Power. If you guys have any questions, definitely reach out to us. We have a health appraisal questionnaire as well that we like to have patients fill out when we're diving deeper into their health. A detoxification questionnaire, and then the full lifestyle evaluation, because other things that can impact kids' lives that they might not be necessarily telling you, stress, right? They might not be talking about their digestive issues with you. When they're younger, what do we always ask? Did you poop today, right? Well, if they haven't, if they have constipation issues, diarrhea issues, that's going to be that gut issue, right? Other things, they might have asthma, allergies, other sensitivities, issues with toxins. So that's the detoxification questionnaire that we like to have them look at and fill out. So there's a whole host of other additional resources that you guys can download, fill out, send in to us, and then we can set up appointments and go over those types of things with you. So, but yeah, utilize this information that we've given you today. Read the book, Nutrient Power. It's super informative for you to make some decisions on, is it a good route to do medications, or should we look at some of these tests from our doctor, or reach out to us if your doctor doesn't want to run those tests, and we can definitely be a good resource to get you those tests and then interpret them and get you guys set up on the road to recovery.